Hello students, this is the last but not the least topic, endocarditis. So far we have learned about pericarditis and myocarditis. Today we will be learning about endocarditis, and which is nothing but an infection or inflammation of the inner lining of the heart. So as we all know, the inner lining of the heart is called as the endocardium. So any sort of infection that is related or associated with this layer is called as endocarditis, and this infection can actually affect the heart valves as well. So endocarditis generally occurs when the bacteria, fungi, or any sort of microorganisms enter the body, and it can spread. You know the various means or modes of spread of infection, which we already studied. Finally, what happens, as we discussed in the previous two sessions again, if these infections are not being taken care of in the very beginning, then this can cause, or it poses, really bad damage to the heart and other major organs. Sorry. The picture here is actually showing you the heart as well as the aortic valve, and how it affects the valve. For example, not just the aortic valve, but how it affects the valve. So with this kind of infection in the inner lining, and you can see how the germs are actually affecting the valves, and due to this, what happens, it is going to become very, very thickened, and the valves are also not going to be functioning effectively. So this is called as a bacterial endocarditis, and in a cross section of that you can see how it looks like. So all this kind of are the ways that the bacterial infection or other any sort of microorganisms can affect the heart linings or the chambers as well as the. So the main causative factors for this will include your oral hygiene, which is very, very important. So that is why, because everything begins from your hand and then straight away into the mouth. So very importantly, you take care of your oral hygiene and avoid any sort of infections. Also, especially when the person is, or when there is a patient in the hospital and having a catheter or a cannula, like an IV cannula, all this, we follow the hospital protocols. You would have heard that saying it has to be changed in 48 to 72 hours. So this is the main reason. We do not want to induce any sort of infection. So because this infection, once it hits the bloodstream, yes, you never know, it can affect all the major organs. So that is the reason why we say when a patient is on a long, many days of Foley's catheter or even a simple IV cannula, we need to change it periodically. Okay. Also very important, when we are using needles for the patient, giving him an injection, make sure you maintain the sterile procedure, especially the nursing staff and also the medical personnel. Ensure that you wash your hands and maintain a sterile environment. Whatever equipment that you're using on the patient is ultra clean or ultra sterile, because we do not want any sort of infections to be induced, because this is what is going to happen. If these infections progress, it's going to be causing major effects or major impacts on the major organs in the patient's body. Again, also, as we told you, oral hygiene. So any problems associated with that, and if you're having a procedure done as well, making sure that everything is taken care of neatly, hygienically, and also in a manner. Now, what happens in this particular condition? So pathophysiology. So basically, it is nothing but an infection of the inner lining of the heart. So there is definitely endothelial damage. Okay. So what happens there? There's going to be a deposition of this kind of microorganisms along the entire lining of the within the heart, and eventually this is going to cause a very bad growth of the bacteria within. So there's going to be colonization, which means the bacteria starts to grow uncontrollably, and this colonization, what happens, it starts affecting, and it starts forming like lesions, or like as you saw in that picture previously what I showed you, and that's going to be causing a drastic spread. Okay, so once this spreads from the lining, and when it almost affects the other structures like the valves, that is when the pumping actions of the heart are going to be affected. Along with this, the person is also going to be experiencing unexplained weight loss. So obviously we know that again, because there's going to be nutritional imbalances, and the patients are going to be eating promptly how we normally did. So yes, there's going to be weight loss. Sometimes when you do this deeper investigations and find out, yes, you will see blood in the urine, okay, maybe seen, and again it could be some kind sort of, even most of your organs are being there's going to be a megaly. So what happens is they get swollen and big, and again all this is because of how the pumping action of the heart is being affected, putting a lot of congestion and increase of pressure, eventually causing this edematous condition. So there's also the patient is in this particular endocarditis, you will see a few important aspects. So which is nothing but called as a Janeway lesion. Okay, so these are nothing but red spots on the soles of your feet. So underneath your feet, you will see that like there are red spots. It can also occur in the palms of your hand. So that kind of lesions, when you spot out, that is called as the Janeway lesions, and this is particularly associated with endocarditis. There is also something called as Osler's nodes. Again, these are nothing but red tender spots under the skin of your fingers and toes. Okay, they can be very, very painful and tender, and again you will see they are red in color, and these are nothing but called as the Osler's nodes. And petechiae is nothing but they are tiny purple or red spots on the skin. Okay, they can appear in the eye, the white of your eye, and it also can occur in the inside of your mouth. So that is called as a petechiae. Some people say it as petechiae, but it is like the petechiae. So these are all the important signs and symptoms that you see. So Janeway lesions, when you hear this anywhere in a patient's folder, and when you read about Osler's nodes or petechiae, then you know that yes, this could be associated with. Now, what are the risk factors associated with this particular condition? There's going to be damage to the heart valves, eventually causing heart chamber damage. So it's going to be heart failure. Again, what's going to happen is the risks are also associated with congenital heart defects. So when a person or a child is born with these particular disease or a diseased heart, again, these are also going to be a risk factor. And any sort of history of endocarditis in the past, that can also be posing a threat. Damaged heart valves, okay, the medical condition where a patient is having any sort of problem with the valves, like all this the person will experience when he starts to have pain or excessive weakness, fatigue, difficulty in breathing, and on inspection and auscultation you will listen to the chest, and again what happens, you listen to a murmur. All these are doubts that build up, and that is when you do a deeper set of diagnostic tests, and eventually you will find out, yes, this could be the problem with the heart or the heart valve. Again, the risk factors will also include the illegal drug usage. So these are all the complications, factors that pose a threat on the patient's health. Now, the complications associated with the particular condition, yes, heart problems leading to heart failure. Patient can end up with a stroke, seizure, which are nothing but, in short, it's called, in other words, it's called as fits. Now, ability to move parts of the body, so that's nothing but paralysis. This is nothing but, as I told you, this impact can be on your nervous system as well. Again, there could be development of abscess, and this can develop anywhere in your heart, your brain, your lungs, or any other organs. Again, pulmonary embolism, so these are nothing but any kind of like clots that again travels to the lungs, anywhere, to the because again, as I told you, the reason could be because the heart is not effectively able to pump, and the blood is going to be getting locked up there, and eventually leading to clot formation. And once, if for some reason when it gets pumped out, then this clot can hit anywhere in any kind of artery, blocking the way of circulation, and this can be anywhere in the patient's body. Also, there could be kidney damage and also an enlarged spleen. These are all the complicated with the particular condition. Now, the diagnosis for this particular disease will include, again, history collection, physical examination, followed by blood test, electrocardiogram or ECG, echocardiogram, which gives you a deeper view or an idea about your heart's chambers, the amount of blood that is flowing through, and also it tells you in deep about your contractility, about the pumping ability of the heart. The patient may also be told to get a CT done or an MRI, and just to rule out. Along with this, as we mentioned, yes, if the person is experiencing edematous situation, then yes, diuretics are going to be there, and also making sure if there are any other comorbidities, then even those aspects have to be taken care of. Nursing management, what happens, most importantly, yes, the patient will be monitored closely. A thorough physical examination, and also listening to the chest will be done. So basically ruling out murmurs, and also important is that the nurse has to monitor the patients if any signs and symptoms are present. As we know, in endocarditis there are different important aspects like petechiae, Osler's nodes, and also Janeway lesions. So, and also along with that, the other signs and symptoms that comes with the disease. So the close monitoring and observation is very, very important, making sure even the patient's vital signs are monitored thoroughly, because Yes, we know when there's an infection, yes, there is going to be a temperature rise, and this also has to be taken care of. Nursing management, and also the nursing. So nursing management, basically it starts off with the nurse's roles and responsibilities, what the nurse performs in the clinical area, followed by the nursing process. You have to always remember this, because this goes with the nursing management topic. So nursing process will include your SOPIA or ADPI. So it gives you a detailed information about the patient, his health history, his physical assessment, and that means entire systems of the body are being attended to and also being assessed properly. So the nursing process has to be followed, and also followed with the nurse will also again assess the problems, prioritize the problems, and also comes to a conclusion about, yes, what the diagnosis is, and based on that, yes, will plan the nursing care as per priority, then will implement this care, and then also will evaluate the care. The nursing diagnosis associated with this particular disease will be, yes, difficulty in breathing, so ineffective breathing pattern will be the priority, and yes, if the person is complaining of chest pain, then pain will also be the priority. Also, you can tell about decreased cardiac output, because obviously you know that again the pumping activity will be affected, so they're obviously going to be decreased cardiac output, anxiety, imbalanced nutritional status, risks associated with a particular disease condition, activity intolerance, and followed by deficient knowledge. So these are all the important nursing diagnosis as per priority. Now the management, so medical management, as we know, yes, symptomatic treatment, and also taking care of or paying attention to the comorbidities as well, and surgical management will also be, as we've seen that, yes, since it's coming back to the valves, we always know what has to be done, so either a valvuloplasty or again a surgical valve repair or replacement, that as we have learned in our previous session. So putting in a biological valve or a mechanical valve, this was going to take care of the problem. Again, we've learned all this in our previous sessions. Also, we need to really educate the patient and the family about the preventive aspects, emphasizing much on the lifestyle as well as the home remedies, and the importance of making sure the patient does his follow-up sessions very, very promptly. And I think with this, the end of the session, and we have finished with the infection and inflammation of the heart. Thank you for your time.